Again, this is not something a lot of PTs use. I use it a little bit more if I'm doing any athletic training services. It's basically trying to figure out if there's a fracture present. The key is that there can't be an obvious deformity. If you come up and you're dislocated and your finger's like this, I'm not going to tap on your finger, right? If you have a bone sticking out, I don't need to tap to see that you have a fracture. This would be a situation where you're telling me you have long bone pain, meaning pain that's generally not at an IP joint or a DIP joint. That's a weird or different place to have pain. Commonly when we have like a sprain of the muscle or sprain of the ligament, you're going to see it at a joint. So we either take a reflex hammer, more commonly when we're in the field, we're just going to tap his finger like so, right? What we're trying to do is produce pain. Pain production, not necessarily at the joint. So again, if you're having a lot of pain at the joint and you sprained your joint, that's probably not a fracture situation. So we're trying to put weight basically through your finger. If you had a fractured tibia, you stood on it, it would hurt. So you're putting weight through it. We're basically trying to put weight through your finger or vibration through your finger to see if it hurts. All right? So that's a tap or percussion test. Long finger flexion test. Our finger flexors are way more important to us than our finger extensors. Now we want to be able to open the hand, but it's critical to be able to grip onto something. So this is a simple test. The position is somewhat important. We kind of learned last class that we don't really want to do it like this because gravity can kind of help you close your fingers. So we're doing what's called a blocking. So I isolate the finger, let's say it's his index finger, right? And I just have him bend up his finger where I'm blocking. So that's PIP flexion. That tests the integrity of the superficialis as well as the profundus. Then I move down to the DIP and have him do it again. If he can't do that, that only tests the profundus, right? The superficialis does not go down to the DIP. So if he couldn't do his DIP, it would be a profundus issue. If he can't do his PIP, it can be both. That's not an exclusive test. It could be superficialis or profundus. Usually means it's lacerated or it's ruptured, right? So if they can't actively do it, we have a tendon problem. That's an interesting scenario for you, as we're going to learn next week. If for some reason they haven't seen a doctor, if you see a friend that does that, they usually have to have surgery within 7 days. If after 7 days goes by, the chance of successful surgery goes down incrementally, all right? So if for some reason your buddy, we get this a lot if you're playing flag football or something, you stick your hand up, you grab a hold of a jersey and kind of forcefully pull. So it maybe rips a tendon loose. And they say, I can't bend my finger. That's something that you don't want to say, hey, maybe just rest it and see what happens. That's go ahead and see the doctor. Because again, if they see the doctor, they'll get to a surgeon pretty quickly if you're right, okay? So that's a long finger flexion test. And that also becomes a treatment for us. A lot of times when we have a finger issue, we'll do blocking. What blocking means, we're trying to, so if I'm here, then I just have him repeatedly kind of bend down and bend that finger. So that's an exercise. So that's actively saying I'm doing profundus, flexor digitorum profundus strengthening, or blocking at the IP joint. So I would be here and go there, right? So blocking is what we're doing, okay? Finkelstein's test is my favorite test because I like to say the name, all right? It is for tenosynovitis of the abductor pollicis longus and extensor pollicis brevis. Those two tendons, again, make up the anterior border of the anatomical snuff box. We just did this test. We did it as a passive length test. The Finkelstein test is an active test where all you're doing is you're doing the length test by doing it to yourself. You're gripping down your thumb, and then I am ulnarly deviating, and I should feel that pull right through there. So pain provocation with that is a positive for tenosynovitis. Okay? You can actually go back here. Go. I got two more, but I'll show these two behind you. So that's Finkelstein's. Positive for de Quervain's tenosynovitis. Right? De Quervain's tenosynovitis, which means APL or EPB tendonitis. All right?
Or what? EPB?
Yep, and I think they're probably written down here. Yep, EPB, extensor pollicis brevis, or APL, right there on that. Yep. So last two tests we're going to do now are Phalen's and reverse Phalen's. I think Phalen's is more of that compression of the carpal tunnel. Both of them are carpal tunnel related. So Phalen's is where I put the dorsal hand together like that and I hold for 1 minute. This is a Phelan's test. As I'm holding there for 1 minute, if I get numbness, tingling in my median nerve distribution, which is usually these 3 fingers, sometimes a little bit of the thumb, that'd be a positive test. Reverse Phelan's is just a stretching of that, so I'm just kind of in this position, right? That's a reverse Phelan's, so it's more of a nerve stretch. Same concept, I stay there for a minute, all right? So it's just, you're doing a different thing to the carpal tunnel. Instead of compressing it, you're kind of really stretching more the nerve. I do both, all right? So let's do those 5 tests.